Good afternoon, everyone. My name is Kimberly Wahama Deshane, and I'm the Operations and Events Manager at Northern Ontario Angels. Today, I have the pleasure of interviewing 3 team members from iRegained Inc. in Sudbury. So today, welcome. We've got Samir Sahu, Vineet Johnson, and Joel Leiderman. Samir, over to you.
Thank you. Thank you so much for the opportunity. So I'd like to give a quick elevator pitch of iRegained. iRegained is a company that wants to help 100 million stroke survivors worldwide live independently once again. We are a medtech company that has developed the MyHand system, a proprietary targeted hand function rehabilitation system. It is a smart, connected mechatronic device with clinically effective cloud-based proprietary neuroplasticity enhancing hand function training protocols and highly engaging games that is delivered through a telemedicine platform, which is very critical in today's pandemic and COVID-19 world. And we are here to make a difference in the lives of stroke patients and traumatic brain injury patients.
Thank you, Samir.
Thanks,
Vineet. Vineet's going to give us a pitch deck on iRegained Inc.
Good afternoon, everyone. My name is Vineet. I'm the founder and CEO of iRegained. My job today is to introduce iRegained to you. When someone gets a stroke, a part of the brain is damaged, and as a result of that damage, your hand function could be compromised. There's nothing wrong with the hand itself, but the connection from the brain to the hand is compromised. As a result, we at iRegained look at ways to create circuitry around the damaged area of the brain to help restore their hand function. I am a physical therapist and a neuroscientist by training, and along with our team of engineers and programmers and designers and business development folks, here's a solution that we present. So approximately 2 people get a stroke every 3 minutes in the US. In Canada, it's about 1 person for every 3 minutes. Worldwide, 15 million people get a stroke. Look at this image on the screen. This individual is attempting to grab that glass of water and they're unable to do so. They're trying to get support from the other hand and they're still not able to do so. 70% of the people who have stroke have a problem with their hand function and they suffer from this problem. They cannot use their hands. They cannot live independently. There is no effective, affordable intervention at this point of time, and people are forced to live with their disability for the rest of their lives. So what happens in the current system? Someone gets a stroke, they go to a hospital, they're medically managed, and they're sent home. If they're really lucky, or if they have insurance, or if they have lots of extended health care and all of those, they get some amount of extra rehab. And this extra rehab allows individuals to secure rehab for standing or balance training or walking training, but the hand function itself is largely ignored. And we at iRegained want to change that and provide a solution where none exists at this point of time. So iRegained has established a new hand function rehab paradigm, which leverages our novel IOMT platform. IOMT stands for Internet of Medical Things. It truly is a new option for individuals, both clinicians and patients. So our solution allows for improving hand function so these individuals can live a life independently once again. It's done through our smart connected system, which offers a new paradigm. When a clinician gets a device in a hospital or a rehab hospital or a clinic, they then go to the iRegained app store where they download various modules. There are protocol modules. There are 16 different protocol modules. Like the first one, for example, holding a coffee mug is one module. Holding a pen is another module. Like that, everyday functions, we have about 16 different modules. Once they download that, they could provide therapy for hand function using those function target-oriented modules. Alternatively, they could also download associated games for each of those protocols, and the same therapy can be provided in a gamified format in a very engaging environment So individuals are more addicted to their therapy, so to speak. In other words, they are more focused on doing what they want, thereby improving their hand function over time. The third option, once this patient goes back home or they're so interested in the therapy and they want to buy a device and they take it home, the clinician can provide the same therapy through telemedicine in the comfort of the patient's home. We currently have a product, and using our product, we conduct our customer validation trials and clinical trials. Over the next 12 months post our funding, we are working hard to convert that into a commercial version of the product, and we're working at that at this point in time. So what is our service ecosystem? iRegained is the company. Our customer to start with is a stroke rehab facility. Eventually, the user will also be a customer, but to start with, the customer is a stroke rehab facility. So when iRegained sells our products and services, the various options, that the SaaS platform options that we have, including telerehab, including protocols and games, each of those sale and usage by the customer provides revenues to iRegained. When the customer then provides the same service to the patients in a clinic or in a hospital or at home, iRegained generates revenue from each of those options once again. So from our go-to-market strategy, we initiate with a business-to-business strategy where we sell our products and services to a clinician who works at a clinic or a hospital or a home rehab or a long-term care facility. And the framework for providing therapy where the government funds this therapy exists already in Canada and the US. And so it goes through the exact same workflow. In other words, there is no change to the existing workflow. And once the patient starts using this, they find all the benefits to themselves in improving their hand function. They could talk to their clinician. The clinician then refers them to buy a device so they could take it home. And the clinician then, using telemedicine, provides the same care in the comfort of patient's home. In a post-COVID world, it is very important that people with vulnerable disorders, like a stroke patient, does not go out too much. This provides them that venue to receive the services in the comfort of their home while being well protected from these infectious disorders. Number three, we will also market the product on a B2C model, very similar to what a pharmaceutical company would do, where they highlight a great drug out there and they would tell you, talk to your doctor about this drug and they'll advise you if it's right for you. The same logic here, it creates a market pull, thereby allowing more people access to the therapy and the systems and the services. So from a competitive point of view, there are lots of devices out there referred to as the passive devices. Now, these can range from a squeeze ball to an elastic band to a glove. They are ineffective. They are more like a crutch. When you take the crutch away, there are no benefits for the patient. The second category is what you call electrical stimulation devices. Once again, it's very similar to that. It's like a crutch. Once you stop the work, there are no long-standing benefits. There is no neuroplastic changes or changes in neural circuitry in the brain happening. The active robotic devices, on the other hand, though effective, are cost prohibitive. They're very expensive. Average clinics or hospitals cannot afford them. And if they can, the cost of providing therapy goes up. That's approximately $230 to $350 for one hour session. Number two, a clinician has to stand there for the entire duration of the time. And considering the fact that a lot of these devices are $200,000 and above, it is very, very cost prohibitive for most institutions. For a fraction of that cost, the iRegain MyHand system allows an easy to use format for patients. They can use it in the comfort of their home so that they don't have to go to a clinic to access therapy. Number three, we have what you call the protocols. That is a unique factor to iRegained. No other product has a similar protocol. These protocols caters to specific targeted hand functions for individuals. Number four, using the data from these protocols that we collect over time, that data then allows us to develop an AI system over time, which on one side allows a extremely customized patient-centered therapy for the patient. On the other side, would potentially allow iRegain to dominate the marketplace, not only in hand function, into other segments of therapy as well. So our clinical evidence from our earlier clinical work, patients were treated over 6 weeks for about 18 one-hour sessions. As you can see, the pre-therapy and post-therapy, they did the exact same activity. In pre-therapy, there is very, very little EMG activity, but post-therapy, you see significant amount of activity over that time. Even though it was only 6 weeks, there was significant change over that time in the electrical activity in the muscle. Though researchers love this kind of data, we also wanted to know what did it matter for the patients. So we looked at the objective and subjective data for the patient. The objective is the Kahi-9 score and subjective is the able hand score. Objective is where the clinician assesses the patient and gives a score. And as you notice, there was significant improvement over that time. The subjective, which is able hand, is a survey on the patients. They're asked a question like, can you hold a pen and write? And the patient responds with answers like easy, difficult, or impossible. And as you notice, there was a significant improvement. In other words, the clinician felt the patient improved, the patient themselves felt they improved over that time as well, even though it was only a 6-week therapy. If this therapy had continued for, let's say, 3 months, the therapy could have been a lot more significant over that duration. From an IP regulatory point of view, I regained IP is a systems and a methods claim. It has a very high competitive barrier. On the regulatory side, it has a very low regulatory barrier. In other words, it's a class 1 device and time to market is very fast. It does not require the costly clinical trials that a class 2 or a class 3 device would require. iRegain has a really, really solid clinical team, management team. Vineet and Ranjit go back 25 plus years of clinical and academic expertise. Mike Tolinar, 25 plus years of experience in the systems and software world. Samir has 15 plus years of experience in business development, working with the medical device company in the marketing and sales segment in particular, with one of the largest medical device company in the world called Zimmer Biomet. Joel Liederman, 45 plus years of experience in the corporate world, in the technological space, in the venture capital space. And most importantly, he worked with Mars Innovation, was one of the founder members of Mars Innovation, retired as vice president of Mars Innovation. He's a colleague, a friend, a mentor, and a very important resource for Team iRegain. The iRegain team also has a key sets of advisors, a very star-studded team from the academic world and from the business world who help us advance in each of our steps. Dr. Jocelyn Harris is the author of the GRASP protocol, which is currently what you call the gold standard for hand function therapy. It's a manually administered hand function therapeutic tool used across the planet, and she is the chair of the clinical advisory board for iRegain. Our clinical, despite the challenges from COVID, we've got, through word of mouth, we've enabled ourselves to have a lot of clinical traction. On one side, we have patients, every patient who's worked with us, either on research setting or customer validation setting, is very keen on buying our device. A number of clinicians and clinics have expressed interest in buying our device and testing it in their own clinics. A number of hospitals have expressed interest, including the Timmins Hospital, the Thunder Bay Hospitals, and the Sudbury Hospital, along with Hamilton, Sunnybrook, and Baycrest in Toronto, who have all expressed interest in trying our device with their respective patients in their hospitals. And we've made significant scientific collaborations in US, Canada, Israel, and India. We've also been a member of a number of key incubators and accelerators. Mars Innovation obviously is the #1 incubator in Canada. Octane and is one of the largest medical device incubator in the US, based in Orange County. CTA is a Canadian Trade Commission run accelerator, we just graduated from the CTA about 2-3 weeks ago. Each year, the Canadian Trade Commissioner picks about 10 to 11 companies in the medical device space, and they are allowed to go through this pathway. ARC is one of the largest Incubators in Tel Aviv, Israel, a part of Sheba Medical Center. And we're also part of NORCAT and Foundry in Sudbury. From a financial projections point of view, we expect to break even by end of year 2 with 30% of net margin by year 4 and revenues 50+ million by year 5. We've raised significant amount of money till date, more than $1.5 million, both from dilutive sources through angel investors, most importantly, Northern Ontario angel investors, and non-dilutive sources as well. We've achieved a number of milestones in the areas of product development, clinical validation, human resources, business development. And our current plan is to raise $2 million as part of our pre-Series A round over the next 6 months. These funds will be used towards completing our manufacturing, do our sales and training support training, make our sales and marketing hires, but very, very importantly, create a strong, viable customer base, both in Canada and in the US. And of course, create a strong marketing and communications pathway. And of course, complete our clinical validation, a lot of the funding for which comes from non-dilutive sources. In conclusion, we have a large but poorly met market, a compelling value proposition, a very strong IP, a very low risk regulatory, multiple revenue streams, and very, very importantly, a clinically effective, affordable device, one which patients can use from the comfort of their home. iRegained wants every patient, every clinician, every investor to say iRegained. My name is Vineet Johnson. I am the CEO of iRegained. I'm very, very happy to introduce our story to you anytime, any place. You can call me up at the number listed here. I've got my email here, and you can also look at our website, which has a lot of details about what we do. Thank you so much for your time. Looking forward to meeting you. Happy New Year. Wish you all a COVID-free Happy New Year. Thank you.
Thank you so much, Vineet. That was a great presentation. The first time I saw that presentation was, I believe, in 2016. So you've come a long way, and you've got a great team with you today. So since 2016, you met with our Executive Director, Mary Long-Irwin. How has the relationship with Northern Ontario Angels helped your business?
So I met with Mary at a Timmy's coffee shop in Thunder Bay way back in, I think, June or July 2016. And since then, Mary Long-Irwin has been a very good friend, responding at every time, providing all kinds of advice, making connections with numerous investors. In fact, Mary was the one connected me with UCAM. Mary was also the same individual who connected us with Peter Del Bianco in Sudbury, who was part of the NEMA Angels, which is the Northern Ontario Angel Network group. Mary connected us with Dr. Dennis Reich and Dr. Debbie Saunders. Collectively, because of all of these individuals, iRegained set up our office, our headquarters in Sudbury, and we continue to grow because of the inputs from Mary Long-Irwin and the Northern Ontario Angel team.
That's great. So how would you describe the ideal investor? What are you looking for?
If I can answer that question, Kimberly, we're not looking just for dollars. Our ideal investor will have had a track record of having invested in technology companies, ideally medical device companies, and be prepared and capable to add value. As an example, two of our investors, actually several of our investors who are part of Northern Ontario Angels are featured on the team slide or the advisor slide, and they have provided great both strategic value and in some cases clinical value. I think as well, it's important to understand that while we are a for-profit company, we are also a social impact company. And so our ideal investor really is committed in the long haul to investing in companies that, like ourselves, want to make a social impact. And they need to share our values because, you know, this is a long haul and we're looking for long-term partners. And I guess the final thing that we would be looking for with respect to investors is again, commitment, and that is they need to be there for the long haul. It would be ideal if they could, in future rounds, continue to invest or be there. If life throws us a bit of a curve, as it did with COVID-19, our existing NOA investors really came through and they helped us through some pretty meager times during COVID-19. So again, we're looking for committed investors that are prepared to be there for the long haul and be with us.
Thank you so much, Joel. So as an entrepreneur, what advice would you give to other startup companies?
Joel, do you want to start?
Yeah.
Sure, I guess I can volunteer one, and that is that these entrepreneurs need to be committed to their business. Startups are, and we kind of joke about it, 24/7 type of enterprise. You're always on. If you want to run a startup, if you want to be successful, this is not a side gig. You really need to be committed to it, both in terms of passion and energy and the time that you put in it. And it's essential that you build a team, that you have people on your team who have complementary skills and share the same passion and commitment to the business that you're in.
Yeah.
Clear?
Yeah, I would say, like, this is something that's a unique journey in many aspects. I've been in an incubator, accelerator, helping, advising companies, even spinning out companies. But getting inside a startup and making it successful is a different ball game. I'd say it's not for the faint-hearted. It is a journey that will be like a roller coaster. There will be days when it's very tough, and there will be moments when you have a blast and cheer. But the thing that's most important is to never, ever, ever give up. Keep the mission always in front of you, what you are doing, why you are doing, and ultimately what is the goal you're trying to achieve. And no matter what the situation, always be, I think, adaptable to the situation and find ways to get over obstacles and find the silver lining in every dark cloud and figure out an opportunity in every challenge. I'd say that's just what I've learned through this journey with iRegain, and it's been incredible.
I like to add a few things. Number one, create a good work culture, hire very smart people. Every single hire people who are smarter than yourself. I always like to be the dumbest person in the room, because that is key. And if you, one of the things I've learned is, if you ever feel like you're the smartest person in the room, that's probably the first step that indicates that you failed as a company. Number two, expect failures every single day. Don't get too excited. Don't get too dejected. It's routine. There's nothing personal. Things happen. Learn to deal with it. And then, like what Samir said, and Joel has said this to me numerous times, don't ever give up. If give up is in the itinerary, do not even start this, because it ain't worth your time, because you're building an idea, you're building a dream, you're building a vision, you're building a team. There's so many people's money involved, so many individuals' life involved. So if you're half-hearted, do not even bother starting. If you really want to make it happen all the way, and never ever accept failures and keep going at it, don't ever give up. Yeah, that's pretty much
Thank
it.
you so much. So this ends our interview today. For more information, you can reach us at northernontarioangels.ca. Just as a side note, almost 50% of our entrepreneurs are in the tech business. So we welcome iRegained as one of our entrepreneurs, and we wish you continued success and stay safe.
Thank you.
Thank you. Really appreciate it, Kim. Thank you so much.
You're welcome.